AskReddit by Redditor. Doctors of Reddit, what is your worst case ever? But I saw it on the internet patient? RN. But my favorite was when a patient's family member rudely insisted we give her mother who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink, because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay, then explained drowning to me. Oh gosh. Save us from the daughters that read stuff online. I did home healthcare and took care of a lovely lady in her 90s. She had very bad diabetes, and even though she was constantly monitored and checking in with her doc multiple times a week, it still was not unusual for her to run between 250 to 300 after dinner, a carefully measured and balanced dinner. It freaked me out every time I saw it. Anyway, her daughter kept telling Ma about this juice cleanse she heard about. I kept telling her that it was a really bad idea, but she kept bringing it up because her chiropractor talked about it all the time. I went on vacation for a week, came back and my lady is gone. Hospitalized. You guessed it. As soon as I was out the door her daughter started the juice cleanse. She was going to prove me wrong. Amazingly, this little tiny 97-year-old lady managed to do well enough for 3 days until the evening nurse clocked her blood sugar at over 700. The EMTs couldn't believe it. She was groggy and nauseated, but still conscious and her sweet self. She was in the hospital for over 2 weeks because they just couldn't get her sugars to balance. She came home, but had even more problems than before. Her daughter wouldn't even look at me. She nearly killed her mom to prove herself right. The other day I had a guy come into the ED in tears because he had wrist pain, and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. I love good nurses, but there's areas that they are not trained in. We did an appendectomy on a patient who was like maybe 4 weeks pregnant. After the surgery the nurse called me saying she couldn't hear the fetus's heart anymore after telling the patient that maybe she had a miscarriage during the surgery. Turns out the nurse used a Doppler pre-op and mistook the iliac artery for the fetal heart rate and then couldn't find the artery post-opus. Several levels of WTF in that one. In this day and age of the internet, I'm still surprised people don't use WebMD more. Just this week I was in our workroom when a senior physician sitting next to me was on the phone and suddenly grabbed my arm while desperately trying to keep a straight face. The senior physician was talking to a 24-year-old female patient and the conversation was going, "No ma'am. You can absolutely get pregnant, even if you don't orgasm. No ma'am. Just because he's feeling nauseated the morning after doesn't mean you're pregnant." I mean the WebMD page on this is pretty darn good. It's actually horrifying how little humans know about our own bodies. Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. I actually had pretty advanced serum sickness from strep/penicillin and the nurses told me I was not having any problems. The doc in the ER said he didn't know what it was, but looked it up himself and said, "Yup, you do have serum sickness." It felt nice to be listened to. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy/sleepless/new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said and called me in a panic, saying, "The doctor said the baby has emphysema. Why, that infant never smoked a day in her life." This reminds me of when I was getting married and my husband and I were looking for a hotel to stay at on our wedding night. He called me and said he found one that had a honeymoon suite and included in the package was strawberries and shampoo. We still laugh, almost 30 years later, at the thought of toasting our new marriage with shampoo and not champagne. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. I had a woman come to see me because of abdominal pain. I spent a good 10 to 15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no, because you're not a male and you don't have one. She just said oh and left. Spoiler alert, she had an ovarian cyst. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a stat about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS, and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them, the biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it, and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that sap. I never would have known otherwise that what I was experiencing wasn't normal. On the other side of the fence, I'd asked over 20 doctors if my symptoms might be endometriosis or adenomyosis. Answers were all over the place, including you don't have symptoms at all. What you're describing is normal, 6-month-long periods with crippling pain. Not normal, your symptoms aren't bad enough to be either, and your symptoms are far too severe to be either. I was sent down rabbit holes. Maybe abnormal vaginal bleeding is a gastrointestinal problem, and given BS diagnosis, you must be depressed. Here's a prescription, because obs/gyns are totally the right doctor to diagnose that. Yeah. Turned out it was both endo and adeno. SAP period should be 3 to 7 days, and should not cause you to be bedridden in pain, and should occur roughly monthly. If this isn't the case, see a doctor, then keep seeing more until one freaking listens. I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals, and told the doctor I was positive that was either ringworm or scabies. They told me no, definitely not, and prescribed hydrocortisone for contact dermatitis, and sent me back to work with the animals. 3 days later, it has the telltale ring of ringworm, and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work, since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. I'm an RN in pediatric neurology. We frequently have families who refuse to put their kids on seizure medications regardless of the EEG findings and the fact that they, have seizures and stuff. One family did the research and attempted to cure the child's epilepsy with essential oils, over-the-counter CBD oil, yoga, metal iron wristbands to balance the brain. They even went as far as having the kid's dental fillings removed and replaced with a non-metallic filling. There was the time that someone told us she didn't need medication because if you opened a fizzy can of Pepsi and put it under her nose she would come out of a seizure. If that didn't work, you could whisper Reese's Pieces in her ear and she would stop seizing. My least favorite visits are from parents who refuse to believe that their kid is twitching because they have motor tics and likely Tourette's instead of epilepsy. Like, if it was a choice between Tourette's and epilepsy, you should choose Tourette's all day long. Why these parents are hell-bent on giving their kids a diagnosis of epilepsy is beyond me. I just don't even know anymore. Veterinarian here. This is the worst I ever had, but not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examine the kitten, and sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals to, so I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good, because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google, and it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassiere supported tit through the neck of the moo to show me the ringworm lesion on the top of her left boob. Yes, that's a ringworm lesion on your pendulous breast. Now please put it away.
Thanks for watching the video. Please leave a like and subscribe for daily Reddit content.